to the platform Swiss Liver Patients Association, Swiss HEPA. Today with the interview with Dr. Benedetta Terziroli, Hepatocentro Ticino in Lugano, on the topic Autoimmune Hepatitis. Welcome, Dr. Benedetta Terziroli.
Thank you, Karina and Swiss HEPA for the kind invitation. I'm very happy to be here today to answer your questions on autoimmune hepatitis for our patients.
My first question is, what is autoimmune hepatitis?
Autoimmune hepatitis is an inflammation of the liver due to the immune system, meaning that the immune system produces the inflammation, the inflammatory attack to the liver. And this causes this chronic inflammation, which is chronic, meaning it does not resolve itself. We need to treat it in order to avoid progression to liver cirrhosis.
What causes autoimmune hepatitis?
This is unfortunately not known. What we know are risk factors. Risk factors include gender, since the disease affects mainly females. Another risk factor is age. The disease is rare in elderly people. It affects children or young adults. Another risk factor is a genetic predispositions, and this is mirrored by the frequent presence of other family members affected by autoimmune diseases. Other risk factors include viruses. We know that a previous contact with a wide variety of viruses, including but not only viral hepatitis viruses, can predispose to autoimmune hepatitis. Another important risk factors are drugs. Drugs are also toxins, even natural toxins from plant-based drugs.
Is autoimmune hepatitis contagious?
Autoimmune hepatitis is not contagious, meaning that it cannot be transmitted from one person to the other.
What are the symptoms?
There is a wide variety of symptoms of autoimmune hepatitis, and it is important to say that about 1/3 of the adults presenting with autoimmune hepatitis do not have symptoms at all, and the disease is discovered by chance while doing blood tests for other reasons or for health control. Possible symptoms include fatigue, joint pains, amenorrhea, or rarely the disease can present in adults with jaundice, so with an acute hepatitis, jaundice or even ascites. This is rare, but it's possible. In children, an acute presentation is more frequent. Nevertheless, the disease responds very well to the treatment.
How can autoimmune hepatitis be diagnosed?
So we unfortunately do not have a single diagnostic test to diagnose autoimmune hepatitis, in contrast to, for instance, viral hepatitis, which can be easily diagnosed if we detect the virus in the blood of the patient or antibodies against the virus. For autoimmune hepatitis, the diagnosis relies on a combination of several factors, including the clinical presentation, so the symptoms of the patient, the history of the patient, and the blood tests are important for sure. And in the blood test, the transaminases are almost universally elevated. There are circulating positive autoimmune antibodies. High IgG are also a very important diagnostic feature of the disease. It is important to rule out viral hepatitis, and liver biopsy is also key to the diagnosis because the type of the inflammation due to autoimmune hepatitis has some features which are very characteristic for autoimmune hepatitis, including the interface hepatitis and the high number of plasma cells in the liver biopsy.
How widespread is autoimmune hepatitis?
Autoimmune hepatitis is considered a rare disease. It is not an extremely rare disease. It is a frequent rare disease. Autoimmune hepatitis type 1 is far more common than autoimmune hepatitis type 2, which is a true rare disease affecting mostly children.
Okay. Is there any other information about autoimmune hepatitis?
What is important that patients know is that autoimmune hepatitis, if left untreated, universally progresses to liver cirrhosis. So it is very dangerous not to treat autoimmune hepatitis. And this is very well reported in the early studies dating back to the 60s, where patients were treated with steroids or were left untreated. And the survival after 5 years is really impressively different in patients treated or untreated. So what I would like to stress for our patients is that the disease must be treated. But if treated correctly, the vast majority of the patients achieve disease remission and can have a very good, I would say, normal quality of life.
A final question. As a specialist, what do you recommend to patients with autoimmune hepatitis?
I think that an important message is that to have a good communication with the physician, with the treating doctor. Because if this is not the case, then patients often do not take the medication as prescribed. And this is, as mentioned, very dangerous. So if the patient is concerned about side effects or about any other thing, it is essential to discuss this with the treating physician and to address this. And we can adapt the treatment, we can change the treatment, we can do a lot of things. But we should really avoid that the disease is left untreated.
Mm-hmm. Many thanks to Dr. Terziroli for the understandable and helpful interview, which is an additional important source of information for patients. Thank you very much, Dr. Terziroli.
Thank you, Karina, and goodbye to everybody.